A concussion is an injury to the brain that is caused when a force is applied to the head or body. They are the most common type of head injury, with over 200,000 occurring per year in Canada. Brain injuries are classified as mild, complicated mild, moderate, or severe, depending upon injury characteristics within minutes to hours of an injury. Concussions are often referred to as mild traumatic brain injuries because they do not cause visible external damage. Instead, they produce changes to the chemical composition of the brain that temporarily interfere with brain functioning. Many things can cause concussions: a direct blow to the head, abrupt speed changes that affect head and body movement, or exposure to an explosion. Concussive injuries may or may not include a loss of consciousness, but do involve at least an alteration of consciousness, such as being dazed, confused, or disoriented. People with a concussion may also struggle to form memories around the time of injury. Symptoms of a concussion can include a combination of the following: physical symptoms, such as headache, dizziness, and sensitivity to noise and light; emotional and behavioral symptoms, such as irritability, mood changes, anger, sadness, frustration and depression; and cognitive symptoms, such as confusion, disorientation, trouble concentrating, slowed thinking, and short-term memory problems. Clinical recovery from a concussion usually occurs between 10 days and 3 months after the injury. Recovery time will vary depending on the severity of the injury, the number of symptoms experienced, pre-injury psychological or neurodevelopmental conditions, a person's psychosocial environment, and clinical management strategies. Risk factors for prolonged symptoms include history of previous concussions, being female, comorbid medical conditions like migraines, psychological conditions, a history of learning or attention difficulties, substance abuse, and an adolescent age range. Consensus regarding effective treatment for concussion has yet to be identified. Research tells us that the brain needs time to heal. Typically, an initial but brief period of physical and mental rest, good quality sleep, a healthy and balanced diet, and relaxation is recommended. Mild physical exertion may be beneficial in the recovery process, starting as soon as 3 days post-injury. Decisions regarding returning to school, work, and sports should be made in consultation with a physician or neuropsychologist. Psychologists can help in numerous ways, including assessment, treatment, and conducting research. Clinical neuropsychologists are licensed psychologists with expertise in brain-behavior relationships and knowledge of the interplay among neurological, psychological, and behavioral factors. They have expertise in the areas of assessment, intervention, and psychometrics in the context of brain injury, and are uniquely qualified to interpret measures of cognitive and emotional functioning as impacts of concussion. Because of this, they are well positioned to educate patients about concussion symptoms and recovery patterns. They can also recommend strategies to help manage symptoms of concussion during the recovery process. In the case of psychological or emotional difficulties following a concussion, such as depression and anxiety, short-term psychological treatment may be suggested. A clinical psychologist typically provides post-concussion psychological treatment. This treatment may address emotional responses to concussion and the associated changes in activity and family dynamics. Patients requiring medications are referred to a medical practitioner, such as a family doctor. If one is suspected to have experienced a concussion, regardless of whether symptoms are mild or severe, it is important to immediately see a physician to rule out a more serious brain injury that can become life-threatening. To find more information about concussions, please visit the following URLs. To find a registered psychologist near you, visit the following page.